The first time was a visit actually to Thailand, and I saw a hospital that was very much overrun with people with dengue. I've never become sick and knowingly had dengue, when there are more people with dengue than there are beds.
Saya intip ya dari data kasus DBD di Indonesia melalui laman Kementerian Kesehatan, jumlahnya ternyata nggak main-main. Ada ratusan bahkan ribuan nyawa melayang setiap tahunnya karena kasus demam berdarah. Bahkan menurut data di tahun 2022, 73% dari 1.183 kematian karena demam berdarah didominasi oleh anak-anak dari usia 0 hingga 14 tahun. Ini tentu menjadi perhatian kita bersama tentunya ya. Kita lihat datanya di layar. Ini kami tampilkan data kasus demam berdarah dalam 10 tahun terakhir. Kalau saya lihat dari angkanya, tampaknya memang tidak ada jumlah penurunan yang signifikan dari tahun ke tahun. Oke. Sementara untuk tahun 2023 hingga minggu ke-17 saja ini sudah ada 28.579 kasus dan angka ini tentunya berpotensi terus bertambah. Kita lihat bersama di layar. Dan katanya sudah ada vaksin yang bisa mencegah kita terhindar dari virus DBD ini. Saya ingin ke Dr. Derek Wallace. Age groups are recommended to receive the vaccine.
In Indonesia,
yes.
the BPOM have recommended the vaccine be used between the age of 6 and 45.
And there are any people who are not recommended to receive the injection?
So it's recommended broadly across that range of 6 to 45.
Okay.
But in terms of specifically who should get the vaccine, that's really a discussion between the individual and their doctor.
Okay, but have you ever got the dengue itself for you?
Myself, no. Fortunately,
No?
I haven't. Not that I know of. Although I have lived in places that have dengue, I've never become sick and knowingly had dengue. But I have been working on a dengue vaccine for about 15 years now. The first time was a visit actually to Thailand, and I saw a hospital that was very much overrun with people with dengue. So there were lots and lots of cases, and it was the first time that I'd seen an intensive care unit that was specifically for people with dengue. And that had a very big impression on me as an individual. And I've been working on a dengue vaccine ever since then.
Okay. It's very interesting to know that you have been working in this area for several years, and we know that 15 years in Indonesia, the case of the dengue vaccines is increasing until now. Why do you want to work in this area, like doing the research about this dengue vaccine?
Well, I think when you have a public health issue, like an infectious disease like dengue, and there are so many very bright people working on it, and it continues to get worse, then I think that motivates people to try to find a solution. During that 15 years that I've been working on dengue, the amount of dengue has actually increased by nearly 8 times. So this is something that is getting worse. As soon as you get more contact between people and mosquitoes in places that can have the Aedes aegypti mosquito, you have the potential for dengue. And we see dengue occurring in places that we think of like Indonesia, but it also can occur locally in places like South Korea, in Japan. It's happened in southern parts of the US, in Portugal and in France. So as the mosquito vector spreads, the potential for dengue also spreads. And the spread of the mosquitoes influenced by things like global warming, by urbanization, and by globalization. So as people move in the globe more, there's more potential for people who have dengue to go somewhere where the mosquitoes exist and create local transmission of dengue. So this is a global health, I would call it an emergency, except we've been facing it for so long, we don't think of it as an emergency. And I think we need to be more ambitious, and I actually praise Indonesia for its very ambitious zero deaths dengue by 2030, because I think we really need to focus on, this is a disease that's getting worse. How do we use multiple tools to improve or to reduce the burden of dengue?
Okay, talking about the development of the vaccine itself, how about the efficacy rate of your vaccine?
Okay, so we've tested this vaccine in many people in many countries over many years.
Okay.
So we've had about 13 years of clinical development involving about 19 different clinical studies. And we've studied the vaccine in children through to adults. We've done it in areas that are endemic for dengue and not endemic for dengue. We've studied in 13 different countries. And the pivotal study that we have is an efficacy study, which was conducted in 8 different countries in Central and South America, as well as in Southeast Asia. And in that we showed that the vaccine is able to reduce dengue hospitalization by about 90% in the first year and a half after vaccination, and 84% reduction in hospitalization over 4.5 years. So we think this vaccine has the potential for really helping to reduce the burden in places like Indonesia.
Apakah betul vaksin dengue ini justru meningkatkan risiko terkena penyakit demam berdarah pada orang yang belum pernah terinfeksi?
Ya, itu kan teori ya, teori yang kita sebut antibody dependent enhancement. Nah, itu memang ada di dalam teori, tapi dalam kenyataannya sebetulnya tidak demikian. Saya mengikuti sebelum ini kan ada vaksin yang lain. Itu saya dulu menjadi PI di situ, dan itu kita follow up sampai 10 tahun dan itu tidak terjadi ternyata untuk vaksin ini. Tetapi memang di dalam penelitian itu ada yang di dalam tubuh manusia, ada yang di luar. Di laboratorium memang kelihatannya kalau seseorang pernah kena dengue, terinfeksi, kemudian dia kedua kalinya kena, tetapi bukan dengan serotipe yang sama. Jadi dengue itu ada 4 serotipe, dengue 1, dengue 2, dengue 3, dan dengue 4. Itu serotipenya. Jadi kalau katakan sekarang misalnya saya dapat dengue 1, kemudian nanti tahun depan saya dapat dengue 2. Nah, itu tidak ada cross reaksi di sini, sehingga itu menjadi berat. Itu teorinya seperti itu. Nah, itu ditakutkan dengan adanya vaksin. Tetapi ternyata di vaksin tidak terbukti seperti itu. Jadi karena vaksin kan juga sudah diolah, virusnya sangat-sangat tidak ganas gitu loh. Jadi sebetulnya vaksinasi itu kan sama seperti kena infeksi virus juga, hanya virusnya diperlemah sehingga dia tidak menimbulkan penyakit tetapi menimbulkan kekebalan. Nah, di sini ininya. Makanya kita ada clinical trial 1, 2, 3 itu adalah untuk membuktikan itu. Keamanan nomor 1 dulu. Aman apa tidak itu clinical yang pertama. Uji klinis atau clinical trial. Kalau itu aman, baru dilanjutkan studi uji klinis nomor 2. Melihat berapa tingginya si antibodinya. Oh, biar dia tinggi. Oh, berapa lama dia bertahan. Apakah perlu booster dan sebagainya. Berapa dosisnya yang tepat. Itu di clinical trial yang kedua. Kalau itu semuanya sudah ketahui, baru kita masuk seperti tadi Derek, uji efikasi. Nah, uji efikasi itu besar. Seperti tadi kita ada 8 atau 9 negara, jumlahnya juga sekitar puluhan ribu. Nah, dari situ kita bisa lihat, oh ternyata dengue bisa mencegah untuk perawatan sampai 80%. Nah, begitu. Jadi itulah mengapa membuat vaksin itu tidak mudah dan tidak sebentar. Karena kita betul
panjang begitu juga.
Dan harus yakin betul bahwa dia aman dan efektif. Kalau enggak ya buat apa? Ya kan?
Tapi Prof, berarti kesimpulannya vaksin dengue ini berarti tidak benar meningkatkan resiko terkena penyakit demam berdarah atau dengue pada orang yang belum pernah terinfeksi.
Sampai saat ini demikian.
Sampai
ini karena
saat ini
kita
ya,
kan masih long term ya, long term follow up kan.
Betul.
Ya,
betul.
seperti ini targetnya udah sampai 5 tahun ini. 5 tahun aman-aman saja gitu. Kita tidak tahu nanti 10 tahun lagi gitu kan. Dan itu kan kita monitor tiap tahun. Dan itu kita report semuanya.
Oke, ini buat teman-teman Liputan 6 sudah terpatahkan ya. Tadi saya sudah konfirmasi, apa betul vaksin dengue justru meningkatkan risiko terkena penyakit dengue pada orang yang belum pernah terinfeksi. Saya akan tanyakan hal yang sama ke Dr. Derek.
Thing that Takeda has been working on, we've assessed it in both people who have and haven't had dengue before, and we've seen that it reduces the risk of hospitalization in both of those groups of people. So the recommendation from BPOM is that it can be used irrespective of whether you've had dengue before or not. So this is something that happens after natural infection. So one of the risk factors for severe dengue is previous infection. So as Sri mentioned, there are 4 serotypes of dengue, and exposure to one serotype is a risk factor for severe disease in a second exposure. And so in vaccine development, that's something we need to look at very carefully. Is there potential for the first dose of the vaccine to act like a first infection, where the next natural exposure, the first, is worse than it otherwise would have been? And we have not seen that in our clinical program. So we've followed people 4.5 years after vaccination, which is longer than the period that we would expect to see that observation of enhancement. In fact, the World Health Organization has guidelines on how to develop a dengue vaccine. And one of their recommendations is to follow for 3 to 5 years after vaccination. And the rationale for that 3 to 5 years is that so we can observe what's happening after vaccination to look for exactly that phenomenon. And we've done that, and we have not seen that phenomenon.
So far, how safe is the dengue vaccine for people? Are there any possible side effects?
Well, I think of safety in 2 ways. The first is exactly what we've been talking about, the potential for increased disease severity, and we haven't seen that. The other thing is what happens when you receive a vaccine. Are there reactions to the vaccine? We look at these in terms of general reactions, so things like headache or fever, and there's very little reaction from vaccination in this sense. The other is what happens directly linked to where the vaccine is given, and we do see an increased rate of things like pain and some redness around that. So when we compare to placebo, it's a little bit higher.
Tadi sudah dijelaskan terkait dengan konfirmasi apakah pemberian vaksin dengue ini justru meningkatkan resiko terkena penyakit demam berdarah. Jen sudah dijawab tadi oleh Prof. Sri Rizky dan juga Dr. Derek Wallace. Juga tadi terkait dengan seberapa aman sih penggunaan dari vaksin demam berdarah ini. Selanjutnya yang saya tunggu-tunggu juga harganya. Well, it's very nice, Derek, to know more about the explanation that you have told us before about the price. So, how much is the price for the dengue vaccines?
So before mentioning the actual price, I think maybe I can explain a little bit about the principles about how we price a vaccine with Takeda.
Okay.
So we recognize that the value of a vaccine is that it gets used and prevents the disease it's intended to prevent. And in order to do that, we have to think very carefully about pricing. So we use a principle called tiered pricing, where pricing is relative to affordability in individual countries. And we do this through partnerships. So partnerships with the Ministries of Health, partnership with individual companies, for example, that might provide the vaccine free of charge to their employees.
Okay.
So really, it's the issue of pricing is really an issue of access. So how do we make the vaccine accessible to have to as many people as possible, so it has the most impact on the disease we're trying to prevent.
Okay, is it possible to make it cheaper?
Well, this is about half the price that we would expect for a normal innovative vaccine in Indonesia, and it's far below the price. It's about a third of the price that the vaccine would sell for example, in Europe. And it's important that we work with partners in Indonesia to make the vaccine accessible for those who can't afford that price.
Okay, half of the price does it mean that half of the efficacy rate, or it's just
Not
the
at
same
all,
products?
no.
It's just the price that is cheaper here in Indonesia. Is there any difference with Europe here?
This is a very good quality vaccine.
Okay.
The vaccine quality, or in fact, the vaccine is manufactured in exactly the same site in Germany. So for Europe and for Indonesia, it's the same vaccine manufactured in the same facility. The only thing that changes is the price, because we're looking at affordability in different countries, and that's based on the ability to pay for a vaccine in a country-specific way.
Okay, so how many times do we need to get the vaccines?
We think of vaccines as a primary schedule, so how many doses do you need to get the initial benefits of the vaccine? And this vaccine is a 2-dose primary schedule, so there are 2 doses of vaccine given 3 months apart. After that, we've shown that the vaccine can prevent dengue for up to 4.5 years after. In terms of longer term data on efficacy, that's something that we'll have to develop as we continue to understand how best the vaccine can be used.
How long does the vaccine provided for the next terms?
In terms of protection?
Yes, in terms of protection.
Yes, so we've assessed this for 4.5 years after that second dose, and we've shown that the risk of being hospitalized is reduced very significantly after the vaccine, being hospitalized with dengue. It's about 84% less if you get the vaccine than if you don't. So that's a very significant reduction in the risk of hospitalization, and that's during the 4.5 years after the second dose of vaccine.
And you, Derek, have you ever gotten the vaccine itself for you?
No, I haven't got the vaccine myself. I live in the United States,
Okay.
and the vaccine's still under review in the United States.
Okay.
If I lived in Europe, I would be able to access the have the vaccine because the vaccine's licensed in Europe.
Okay, but are you planning to get the vaccine for yourself in short term?
Certainly I am, also for my children.
Oke, that's very interesting to know. Ke Prof lagi yang mau saya tanyakan, kenapa vaksin ini belum jadi program nasional, Prof?
Ya itu.
Karena kan kalau kita lihat tadi kasusnya lumayan banyak ya, bahkan ini meningkat setiap tahun. The case is increasing every year.
Tapi begini ya, Indonesia ini penuh sekali dengan penyakit-penyakit yang belum selesai gitu.
Oke.
Polio saja belum selesai.
We have some unfinished business in Indonesia.
Kita masih punya DBD, difteri, tetanus, pertussis, TB.
Oke.
Masih belum juga. Jadi itu masih queuing gitu ya. Jadi sekarang tahun ini alhamdulillah sebetulnya Menteri Kesehatan memberikan new vaccine introduction. Kita punya PCV, kita punya HPV, kita punya rotavirus. Itu 3 ini adalah baru. Jadi setelah itu moga-moga dengue masuk di sini gitu loh. Jadi ini kita seperti tadi saya katakan kalau waktu mengintroduksi vaksin baru itu rentetannya panjang sekali gitu. Bukan hanya Menteri Kesehatan tapi juga Menteri Keuangan, juga Bappenas, juga DPR itu semuanya harus agree. Karena itu uang negara kan. Nah ini tidak mudah dan kita sekarang banyak yang ketinggalan kan kita pada waktu COVID karena posyandu tutup, puskesmas juga mengurusi COVID sehingga imunisasinya ambles turun sekali, baik DPT maupun MR, measles, rubella. Nah sekarang kita ngejar itu, jadi sekarang ini lagi ngejar yang ketinggalan, kemudian kita introduksi vaksin baru ada 3 tadi. Jadi ini dengue-nya terpaksa setelah
harus
itu
ngantri dulu ya. Ada banyak penyakit yang masih harus diurusin terlebih dahulu. Tapi kemungkinan besar ini bisa jadi program nasional ya, Prof.
Insya Allah begitu
Insya Allah ya. Apalagi kalau
betul.
Kasusnya meningkat terus.
Ya.
Oke, mengingat Indonesia ini kan seperti yang disebutkan bahwa endemis. Tapi masih harus nunggu selama itu, Prof?
Itulah. Sebetulnya pemerintah sudah mempunyai strategi nasional dan situ sudah masuk vaksin. Jadi ya kita tinggal ya kalau anggarannya ada sih sebetulnya cuma ya itu.
So we've looked at safety across the age range and we don't see any differences in safety and we assess the efficacy in a population between the age of 4 and 16.
No, I mean for the doses.
For the doses, it's still 2 doses across the age ranges.
Okay, for the youth and the adult, it's just the same.
It's the same
doses.
Same vaccine, same number of doses, 2 doses at initial time point and 3 months later.
Okay, so what are things that we need to anticipate from these dengue vaccines? We know that these vaccine brings so many benefits to people, but I believe that there are some kind of side effects from the vaccines. Are there any side effects from this vaccine, for this dengue vaccine that we're talking about?
Yeah, so the way that we look at the vaccine is what's happening immediately post the vaccination. So are there local reactions to the vaccine? And we see some local reactions like injection site pain and redness. Although this is pretty much what we expect for this type of vaccine. It's a live attenuated vaccine and these levels are relatively low. In terms of other safety effects, we haven't seen any important safety effects with this vaccine.
Okay.
Again, there's information on this through BPOM, and it's also a discussion that individuals should have with their doctor. This is a really decision to be vaccinated should be one that is in conjunction with your physician.
Oke, Prof, yang ingin saya tanyakan ke Prof, bagaimana sih kesadaran masyarakat sebetulnya memahami demam berdarah ini? Dan bagaimana sebetulnya peran dari komunitas dengue Indonesia untuk bisa memfasilitasi kebutuhan masyarakat, juga memberikan edukasi dan promosi seperti itu, Prof?
Iya, sebetulnya itu mereka ya udah mengerti ya. Kalau kita bikin kuesioner, 80% mereka kenal yang namanya DBD, itu mereka tahu. Hanya kalau sudah melihat kenyataannya, karena awal-awal penyakitnya itu katakan demam, itu nggak bisa dibedakan apakah itu demam dengue atau mau flu atau mau penyakit yang lain gitu. Nah di sini, jadi kita selalu memberikan penjelasan kalau anak ini demam, apapun sebabnya, lihat sampai 3 hari. Kalau 3 hari demamnya nggak hilang, ini harus mencari pengobatan gitu loh. Karena kalau dengue di 3 hari itu menjadi jelek gitu. Tapi kalau yang lain mungkin 3 hari udah kelihatan, oh ada batuk, ada pilek, udah pasti bukan dengue. Kalau dengue nggak ada batuk pileknya, dia ada mual, ada muntah ada, tetapi tidak ada batuk pilek. Jadi kalau 2 hari tapi ada batuk pilek, alhamdulillah bukan dengue. Tapi kok 3 hari demam tok, mual, muntah, itu nggak mau makan. Nah itu kita mesti sudah hati-hati sekali, karena di situ nanti komplikasinya kelihatan setelah 3 hari.
Oke.
Jadi makanya kita selalu mengatakan 3 hari itu penting sekali diketahui oleh masyarakat. Jadi jangan kemudian ngobatin sendiri sampai udah lebih dari 3 hari, datang-datang udah terlambat. Karena di dalam dengue itu si virus itu merusak pembuluh darah sehingga cairan darah itu rembes keluar. Rembes tapi di dalam badan kita sendiri. Nah kalau rembes, volume darahnya kan menjadi kurang. Kalau kurang, alirannya jadi pelan. Kalau aliran pelan ini, oksigennya juga jadi kurang. Sehingga anak ini shock, nggak sadarkan diri. Nah itu paling sulit diobati. Jadi jangan sampai terjadi shock. Jadi kalau 3 hari pertama, ini pada umumnya masih belum terlalu berat gitu. Nah di sini kita harus memberitahu masyarakat. Jadi kalau perdarahan, kadang-kadang ada mimisan, betul ada. Kadang-kadang ada merah-merah di tangan. Tetapi itu tidak selalu begitu.
Oke. Intinya orang Indonesia sudah lebih banyak paham dan
Betul,
aware
sebetulnya
terhadap
aware.
DBD ini
Ya,
ya. Oke, mungkin lebih ke gaya hidup yang masih tetap dipertahankan yang tadi akhirnya juga membuat kasus ini terus meningkat ya, Prof?
Betul, betul. Apalagi kalau anak itu sudah rada besar ya. Misalnya anak SD kelas berapa, kelas udah 9-10 tahun, itu merasa sakit gitu tuh nggak bilang sama orang tuanya.
Oke, jadi nganggap remeh gitu.
Anggap remeh, dia tetap main begitu. Tahu-tahu udah hari ketiganya udah lewat gitu. Padahal dia udah dari kemarin dia demam gitu.
Setelah hari ketiga kemungkinan besar bisa menyebabkan kematian kah? Gitu, Prof?
Ya, shock kemudian perdarahan. Di situ yang kalau kita nggak obatin ya hampir nggak tertolong nantinya. Jadi dari 20 katakan, jadi dengue itu kan ada yang ringan, ada yang sedang, ada yang berat. Kan gitu ya. Jadi semua penyakit kan selalu ada derajat. Nah, yang ringan ini kalau kita nggak obati, 1 dari 20 pasien ini bisa menjadi berat gitu loh.
Oke.
Nah, itu yang kita nggak tahu siapa yang menjadi berat begitu. Biasanya memang anak-anak, karena anak-anak daya tahannya lebih
rendah
daripada
orang dewasa.
Betul.
Oke, mungkin karena tingkat kesadaran juga belum
Betul.
setinggi orang dewasa sehingga menganggap remeh mungkin ya, Prof ya. Jadi penting juga untuk orang tua yang punya anak-anak mungkin lebih aware begitu terhadap kesehatan sang buah hati agar nantinya juga kasus DBD ini juga bisa berkurang karena atensi dari orang tua begitu ya dan lingkungan. Oke, I would like to ask again to Mr. Derek, but have you ever seen the real patients of these dengue?
Yes, I have. So I've seen the...
How bad it was?
Yes, I have. And I think one of my very strong memories of this is one of fear. I'm a physician by training, and I've been seen lots of... so I'm a doctor by training, and I've seen lots of sick people, but I've never been in a situation that's as frightening as a dengue ward, when there are more people with dengue than there are beds, when the risk of going from essentially a sick child to a child that's fighting for their life can be very quick. Prof. Sri knows all about this. I think that's terrifying. So you might have somebody who's febrile, has a fever, they're feeling sick, but they can go home in a couple of days. But some of these children will quickly end up in a situation where they have some leakage from their blood vessels, and this leakage goes into their lungs. And it's very difficult to manage that. There's no active treatment for that. There's no antiviral drug. There's only things like paracetamol to control fever, and things like fluids to manage fluid balance. And doctors and nurses have to get this exactly right to save these minority of people who become very, very sick. And when you look at a hospital ward that might have 150 people in it, and there might be 5 to 10 of those people who could become very sick, that's very, very scary to quickly identify the right people and to give the right level of fluid to manage a very difficult balance. So yeah, it had such a big impact on me watching it, that I've been working ever since in my career to work on a dengue vaccine. And I'm particularly proud of the vaccine that we have at Takeda. And I'm also very proud to be here in Indonesia, which is the first country to be able to use this vaccine, first endemic country. So I'm thrilled to see that we can finally start to have an impact on this dreadful disease.
Okay, is there any ongoing research to make a better vaccines like?
Always ongoing research. So the first step is to understand, is the vaccine, do we have enough data and confidence in the vaccine that regulators agree to it being available to a population? That's the stage we're at now. The next stage is to really understand how best to use that vaccine. So how do we use it with vector control? How do we use it with the 3M plus that you were talking about earlier? And I think that's going to be very specific to each country, but it's an ongoing process, and it has been for all vaccines, and I think dengue vaccines will be the same. So in terms of safety and efficacy, we understand that. In terms of how the vaccine can be best used in specific settings, that's something we still have to learn. And that's why it's really important that we have partnerships with people like, or groups like MOH, with the immunization policy groups, to really understand specifically in Indonesia, how can we best use this vaccine to reduce the burden of dengue.
Okay, Dr. Derek, one question. Can you tell us, the Indonesian people, about this vaccine, the urgencies, and what do you want to say to Indonesian people about this progress of the vaccine?
Yeah, so I think one of the challenges with dengue is that, especially if you're always living with it, is recognizing that it continues to be a risk. Because there are 4 dengue serotypes, you can have dengue more than once. And often that second exposure can be more likely to be severe. So I'd say dengue is an urgent problem, and it's something that we need to address, not just with vaccines, but also with things like controlling the mosquitoes that spread dengue, and part of that's part of the 3M plus. And I'm actually very impressed with the ambition in Indonesia to reduce the burden of dengue. The Zero Deaths 2030, I think, is a fantastic initiative. And very ambitious.
Oke, tadi sudah dijelaskan berapa harganya, juga tadi efikasi rate-nya atau juga seberapa efektif vaksin ini. Juga tadi sudah dijelaskan seperti apa gejala-gejala dan beberapa hal yang harus diperhatikan ya Prof ya, terkait dengan ketika kita terkena penyakit demam berdarah. Terima kasih saya ucapkan kepada Prof dan juga Dr. Derek about this further explanation, sangat menarik sekali. Semoga-moga ini juga bisa memberikan wawasan kepada teman-teman Liputan 6 yang sudah menyaksikan Liputan 6 Talks kita soal DBD, ampuh nggak ya vaksinnya. Semoga bikin penonton ngeh adanya vaksin dengue. Ikuti terus informasi terkini di Liputan 6 SCTV dan jangan lupa untuk subscribe, share, and comment. Sampai jumpa di Liputan 6 Talks selanjutnya. Saya Gracia Bern, salam SCTV.